Hello everybody, and thank you for joining us today. My name is Amy Rohr, and here with me are Anna Cabrales, Azam, Tayyebi, and Kelli, Stephenson. We are doctoral students at Frontier Nursing University presenting to you today a policy packet proposal to the Hermiston Downtown Farmers Market regarding double-up SNAP benefits to the Umatilla County. Currently, there are approximately 76,000 residents in Umatilla County. 37% of adults are considered obese and roughly 7,000 are living with diabetes. Most people are aware that both obesity and diabetes are very strong risk factors for predicting not just maternal and child health, but also overall health outcomes for a community. But what you may not be aware of is that gestational diabetes, or GDM, is the single most common complication during pregnancy. And it's not just during pregnancy. Women who have gestational diabetes have a 70% chance of developing type 2 diabetes during their lifetime, usually within 28 years. Studies continue to show that pregnancies that are complicated by gestational diabetes have a higher chance of prenatal, labor, or birth complications. These complications can be severe and can have long-lasting effects on both mom and baby, including stillbirth. Studies show that infants born to gestational diabetic mothers are more likely to be obese and develop diabetes in their lifetime. The World Health Organization continues to stress that access to food is fundamental for the promotion of health and well-being. Lack of food as well as excessive intake of low-quality food contributes to obesity, cardiovascular disease, and diabetes in all age groups, but especially in vulnerable groups such as pregnant women and children. Food insecurity, or the inability to buy foods necessary for health and well-being, is associated with buying inexpensive, high-calorie, low-micronutrient foods, and excluding foods like fruits and vegetables because they are too expensive for families. As of June 2018, there were approximately 14,500 residents accessing SNAP benefits in the Umatilla County, with over 50% living in Hermiston. There are multiple SNAP incentive-based programs, but this presentation on one in particular, the double-up SNAP benefits. It is currently available at select farmers markets across Oregon. I had a patient in my office recently who told me that she drove to Pendleton once a month to take advantage of the double-up SNAP program at the farmers market. SNAP is the Student Assistance Program, or what used to be called food stamps. I was curious what this double-up program was and why she drove 45 minutes one way to take advantage of it. Essentially, it's doubling up SNAP benefits up to a preset amount of money for purchases at farmers markets that participate. So a family can get $10 organic locally grown vegetables for only $5. This is gestational diabetic. And she was trying to control her diet, meaning she didn't have to take any meds. She stressed to me that the only way she can afford to get all the food necessary for her family, but also for her diet for gestational diabetes, was to participate in this program. Because of the distance, they were only able to go once a month. Right now, her and her sisters took turns driving monthly so that all their families could benefit. When I asked why she did not go to the market in town, she told me the SNAP benefit program was not available. I was excited like this. It was an incredible resource to women and to the children in the community. Immediately, I began to recognize the benefits, not just to women and children, but to the community as a whole. There are currently over 14,000 participants in the Umatilla County using the SNAP benefits. 50% of those reside in Hermiston, and approximately 2,500 are women and children. As previously discussed, access to food is necessary. It's needed for direct effects on maternal and child health outcomes, but it also affects other diseases such as cardiovascular disease, obesity, and diabetes. Access to food affects the entire health of the community. So the next question to ask is, why should a program like this exist? Studies tell us that programs can do many things. First off, the dollar grossman. That can allow families to purchase healthier foods because they have more money to spend. Second of all, the myth that farmers markets are simply too expensive is dispelled. Produce is grown locally. They're organic and fresh, and it's more affordable for patients. Because of this, families are much more likely to purchase fresh foods when access and cost is not an issue. This would be a huge benefit as well as to the local farmers and the economy, as the Hermiston Farmers Market is held in conjunction with the first Thursday of each month, which is a community-wide event in support of local businesses. On the conservative side, Hermiston Farmers Market Association could reach over 50% of SNAP participants in the Umatilla County if they became an active member. Startup is actually very simple. The farmers market must accept Oregon Trail SNAP cards, which are already in place. There also must be a way to track incentives used at the market that day. Some markets use tokens, others use coupons, chips, etc. There must also be community involvement, which means volunteers as needed to help answer questions, track incentives, and help close the end of the day market to pay the vendors. There is no current data that shows a direct correlation between the Double Up SNAP incentive and the effects of gestational diabetes, but there is evidence that other SNAP incentive-based programs directly impact maternal and child health outcomes in a positive way. The Oregon Farmers Market Association has a free template that can be customized to the needs of the Hermiston area. By partnering up with community stakeholders such as WIC, the Umatilla County Health Department, Nurse Family Partnership, and the team at Good Shepherd's Women's Center, the Hermiston Downtown Farmers Market would only continue to grow and prosper, as well as be a vital staple to the health and well-being of the entire community, but especially with women and children. The statistics, studies, but more importantly, the community will tell you that this is a much-needed benefit that should be added. For more information on the SNAP incentives at farmers markets and what this may look like for the Hermiston community, please visit the Oregon Farmers website shown here. In conclusion, as family nurse practitioners and nurse midwives, we believe that the foundation of a healthy lifestyle is the food we put into our bodies. By offering the Double Up SNAP benefits in Hermiston, we can not only prevent disease, but also improve health outcomes. We would like to conclude with a short 2-minute portion of this video brought to you by the Oregon City Farmers Market that shows what an amazing benefit this would be to the Hermiston community. We thank you for your support.
We are at the Oregon City Farmers Market, and we are getting ready to launch a Know Your Farmer, Know Your Food market tour, where we are going to go around the market, and we're going to meet up with a few of the local growers and learn about their farms and their farming practices, purchase some fresh produce that we're then going to take over to our market kitchen area and prepare a quick and healthy meal using one of Oregon State University's Food Hero recipes. Well, here in Oregon City, as long as you purchase at least $6 worth of SNAP tokens, you get $6 additional to spend on fresh produce. If you come to the Oregon City Market on the second Saturday of the month, then we also provide an additional $5 worth of SNAP tokens to SNAP shoppers that complete the tour on those days. I believe I buy more.
Here are our references. Have a good day.